What if I told you that some of the medical advice we've trusted for years is not only wrong, but actually harmful? Today, I'm exposing 3 myths modern medicine got totally wrong and the dangerous consequences that followed. You've probably been told things like avoid peanuts for young kids, take antibiotics for infections, and fluoride is essential for your teeth. But what if these recommendations were not only wrong, but have actually put millions of people at risk? In this video, I'm going to break down 3 major medical missteps backed by real research and stories. I've put in a lot of effort to dig deep and bring you the facts you need to know to make better health decisions. Let's dive right in. First up is a topic that many people can relate to: peanut allergies. Imagine avoiding a food only to find out later that avoiding it actually caused the very problem you were trying to prevent. Back in 2000, the American Academy of Pediatrics recommended that children under 4, as well as pregnant women, should avoid peanuts to reduce the risk of peanut allergies. But guess what? The opposite happened. By 2019, peanut allergies were skyrocketing. Why? Because by avoiding peanuts, children weren't getting the early exposure needed to build tolerance. Now we know early peanut exposure is actually the safest way to prevent allergies, but the damage has already been done. Emergency room visits for peanut-related anaphylaxis soared, and 1 in every 18 kids in the US developed a peanut allergy. Think twice before following outdated advice. Next, let's talk about another critical issue: antibiotics. Do you know that common antibiotics could be linked to long-term health problems in children? Doctors used to carefully distinguish between bacterial and viral infections before prescribing antibiotics, but not anymore. In an age of quick telehealth visits, antibiotics are handed out like candy. Even for viral infections they can't treat. But here's the shocking part. A Mayo Clinic study found that children who were prescribed antibiotics early in life had higher rates of obesity, asthma, ADHD, and learning disabilities. So, while antibiotics are crucial for fighting infections, overusing them could be doing more harm than good. They wreak havoc on the gut microbiome, which scientists now believe is linked to everything from food allergies to cancer. Next time you're handed antibiotics, ask, is it really necessary? Finally, let's explore a controversial subject: fluoride in drinking water. We've all been told fluoride in drinking water is essential for strong teeth, but could it be harming more than it helps? Since the 1940s, fluoride has been added to tap water across the US with the goal of reducing cavities. But did you know that only 3% of Europe fluoridates their water? Recent studies are raising concerns about fluoride's impact on brain development and gut health. In fact, a 2019 study found that higher levels of fluoride exposure during pregnancy were associated with lower IQ scores in children. It doesn't stop there. Fluoride might also disrupt our gut microbiome. The next time someone tells you fluoridated water is completely safe, remember, there's still a lot we don't know. What was once considered essential may not be as beneficial as we've been led to believe. Before you go, make sure you're not deficient in potassium by watching this video.